All right. Hello and welcome. Today, we're going to peek behind the curtain of the operating room and really demystify the common tools of medicine. From the simplest things to the super specialized, let's explore the instruments that actually make modern surgery happen.
Yeah, you look at it and it can seem like this complex, maybe even kind of intimidating collection of stainless steel. But here's the thing. Every single tool has a very specific job, a purpose that's been refined over decades. So what's it all for? Let's dive in and find out.
Okay, we're going to start with one of the most fundamental categories of surgical instruments, forceps. Now, the best way to think about these isn't just as tools, but as highly specialized extensions of a surgeon's own hands. They allow for incredible precision and control in places where fingers just can't go. So, at their very core, forceps are basically hinged instruments, and they're used for all sorts of things, from grasping tissue to clamping a bleeding vessel. The basic design is pretty simple, but it's the variations on that design that make them so incredibly versatile. Now, this is where it gets really interesting. The most basic, but also the most crucial, distinction between forceps comes down to one simple question. Does it have teeth or not? Toothed forceps, well, they're designed to get a really firm non-slip grip on tougher tissues, like your skin. But the non-toothed ones? They're for handling delicate stuff, like blood vessels, without crushing or damaging them. It's a super simple design choice, but it has life or death implications. Let's look at our first specific type, dissecting forceps. And you've probably already noticed they look a lot like tweezers, right? Well, these are the real workhorses for general tissue handling, whether a surgeon is moving tissue around during a procedure or a nurse is changing a wound dressing. Next up is the artery forceps, which you'll also hear called a hemostat. And this tool is absolutely critical in any surgical kit. You see that scissor-like handle? It has a locking mechanism that lets a surgeon clamp a blood vessel shut, controlling any bleeding, a process we call hemostasis. And then they can let go, which frees up their hands to do other things. So important. Okay, so what if you need a really, really strong grip, for tissue that's tough and dense? That's when you turn to Coacher's forceps. With that toothed tip and a locking system, this instrument is designed to hold on tight and not let go, which makes it a common sight in things like abdominal surgery. But what if the tissue is soft but slippery? That's where the Alice forceps comes into play. Its tip has a whole row of tiny little teeth that interlock. This lets it grasp soft tissue firmly so it doesn't slip away in the middle of a delicate procedure. Pretty clever design. Now, on the complete flip side, some jobs require a much gentler touch. And this just shows you how much thought goes into the design. The Babcock forceps is what we call a non-traumatic tool. Its tip is smooth and rounded, specifically designed to gently cradle delicate internal organs, like the intestine or the appendix, without crushing or damaging them at all. And finally, for this section, we have a highly specialized tool, obstetric forceps. As you can see, it's a large, curved instrument, and it's uniquely designed for one of the most delicate procedures there is, assisting in childbirth by safely guiding the baby's head through the birth canal. So, a surgeon doesn't just grab these tools randomly from a pile. Of course not. They're meticulously organized into kits or trays for very specific procedures. This makes sure that everything they need is sterile, ready to go, and accounted for. Let's take a look at a simple dressing tray, something used thousands of times every single day in clinics and hospitals. It's really a model of efficiency. You've got non-toothed forceps for gently cleaning a wound, sharp scissors for cutting gauze, an artery forceps just in case there's a little bleeding, and even a kidney tray to neatly collect any waste. See? It's a complete self-contained system for one of the most common medical tasks. Now, a suturing tray, that's a step up in specialization. The star of the show here is the needle holder. It's got these powerful jaws that securely grip that tiny curved needle. It's backed up by tissue forceps, which are used to line up the skin edges just right for a neat closure. And then you have these fine-tipped scissors, designed specifically for the delicate job of cutting suture thread. It's a perfect, purpose-built kit for the art of closing a wound. All right, let's shift gears a bit. We're going to move from the specialized world of the operating room to some everyday medical essentials. These are the universal tools that you've almost certainly seen during a doctor's visit. The stethoscope, of course, is the iconic symbol of medicine. But it's so much more than a symbol. It's like a powerful acoustic window into your body. It lets a doctor hear the rhythmic beat of your heart, the rush of air in your lungs, and even the sounds of your digestive system. It turns all these subtle sounds into crucial diagnostic clues. Just as fundamental is the thermometer. I mean, measuring body temperature is one of the most basic vital signs we have, and this simple instrument gives a really quick and crucial clue about a patient's health, often being the first sign of an infection or inflammation. And then you have the blood pressure apparatus, or if you want its technical name, the sphygmomanometer. Yep. That inflatable cuff and gauge measures the pressure in your arteries, giving a really important snapshot of your cardiovascular health during any routine checkup. So let's bring a few of these key tools together, just to see how they create a basic procedural flow. A surgeon starts with a scalpel, the ultimate cutting tool for making that precise incision. Then, scissors might be used for cutting tissue or sutures. And finally, the needle holder is used to accurately close everything back up, cutting, manipulating, and closing. That's the rhythm. And here's the crucial point, the big takeaway from all of this. Every single instrument on a surgeon's tray is a direct answer to a very specific problem. Whether it's, how do I hold a delicate organ gently, or how do I stop this bleeding instantly, each tool has been designed, tested, and perfected to solve that problem, making modern medicine safer and more effective for all of us. You know, these mechanical marvels have really been the foundation of medicine for more than a century. But as we start looking ahead to things like robotic surgery, nanotechnology, and energy-based devices, it leaves us with a pretty fascinating question. What will the surgical toolkit of the future actually look like?